Mr. Chairman, members of the legislature, I want to thank you for this opportunity. My name is Trey Wade, and I'm the Senior Vice President of Patient Family Care for HCI Care Services, formerly Hospice of Central Iowa, and Visiting Nurse Services of Iowa. We serve over 60,000 Iowans in 37 counties every year, many of them in rural communities, many of them in low-income communities. One of the fundamental beliefs for our organization is that all individuals deserve access to needed health care services. Medicaid expansion, simply put, would reach more Iowans at a lesser cost than the Healthy Iowa Plan. We have many people that come to us in need of services where we have to go above and beyond. We find ourselves paying for utilities, groceries, and we often find ourselves taking out of our resources to keep phones on so people are able to get a hold of us in times of crisis. I find it hard to believe that a plan that focuses on getting these low-income people to have to provide a copay is going to be one that results in success. The people we're talking about do not have the ability nor the means. They live day to day, they live hand to mouth, and they really need to put their resources back into their family. I think the result would be people would ignore primary care. They're not going to go get treatment, and we see this in our hospice every day. We see people coming in at end of life, needing care, having nowhere else to go because they ignored signs, they ignored symptoms, and they didn't show up until it was time to show up at the ER after they had an exacerbation of what could have been a preventable disease. I'm asking you if you will consider to expand Medicaid so we can help these Iowans and we can lower health costs for everyone so that they don't show up in our ERs, they don't show up needing high-cost, extremely invasive procedures, and that we can best serve them and their families going forward. Thank you.
Thank you. Next we have